Uh, Good evening, my follower. I welcome you to my channel. I'm Robert Amoy. Today we have a topic for why you won't get cure from your sickness. As a dispenser, you have principle to follow for a patient to have maximum benefit from your work of hand, your professional work. A dispenser, a pharmacy dispenser is trained to have a patient have a benefit from his professional work. So we have criteria to follow, we have procedures and principle to follow. So for this case, we have instruction we have to give to the patient on which medication is given to a patient, for which indication, the route of action, the formulation of the dosage form, the quantity is supposed to be taken, for how many times, or the frequency, for how many days, and which food should be taken with, the reason for taking the food with the drug, and other things related to taking medication, like vomiting, patient unable to take the drug, patient forgetting to take the medication. All those things should be covered by pharmacy dispenser. For example, for this case, our prescription of Coartem, 4 tablets times 2 for 3 days. This, in explanation, we can explain this to the patient. Patient understanding that's 4 tablets of Coartem times 2. Then you, a professional pharmacy technician, what will you tell the patient? This is the right instruction you have to follow or to give to the patient. That means 4 tablets to be taken every 12 hours. Every 12 hours. Like if you start in the 6, at 6, if you give 4 tablets of Coartem at 6 in the morning, you count 12 hours, that will be around 6 in the evening. You give another 4 tablets of medication of Coartem. So if you count from 6 a.m. up to 6 in the evening, it's 12 hours. And from 6 a.m. up to 6 in the morning, and the next day is another 12 hours. So in 24 hours, the person will have taken 8 tablets, 4 tablets in the morning, 2 in the evening. So 24 hours, 8 tablets. That's the right dosing for Coartem. And every time a patient takes a medicine, a 4 tablet of Coartem should be taken with food, preferably fatty food, to ease absorption, for maximum absorption of the medication, to attain a higher and maximum concentration of the medication in the blood, to clear away to suppress the strain of the infection. You do not have to say 4 tablets of Coartem 2 times a day without being specific on which time to take the medication and for how many times a day, for how many and what hours to be taken in a day. So medication should be taken 4 tablets every 12 hours. 6 in the morning, 6 in the evening. Then we have covered the right dosing. Then other thing is a patient might forget this or a drug. So in that case, a patient who has forgotten the drug should immediately take the medication after recognizing that he has forgotten the drug. Maybe if a patient has forgotten a drug maybe for 2 hours or 1.5 hours, immediately you should take the drug. When the medication, when the treatment, the drug has not taken long hours, but if the drug, the time for taking the drug has approached another time for taking the drug, then the patient should immediately take the drug at that time to cover up the treatment plan. Then another thing is patients who are unable to take the medication, like infants and children. There we have to take another consideration. This category of people or patient, the same dosing, the same quantity that have been given, like maybe 2 tablets, 3 tablets, has to be crushed and mixed with a 1 to 2 teaspoonful of water, 5 ml or 10 ml, in a clean container for administration. Then the patient has to be take that infant or a child has to be given that medication. After giving, the traces of the medicine that remain in the container, so it has to be rinsed. The container has to be rinsed with more water and taken or swallowed. Then immediately after swallowing the medication, the patient or an infant should be given milk product or fatty product to be swallowed to enhance on the absorption of the medication in the blood vessels. Then another category of things which might happen after taking medication is vomiting. It may be the patient has taken the drug and within 1 or 2 hours after giving the medication, the person has vomited the medication. The medication has to be repeated, has to be given, have to be repeated. If again the person has vomited the medication, another antimalarial should be given to the patient. Thank you, my viewers. I hope we shall continue from there.